Hello and welcome to the Center for High-Tech Dentistry. My name is Dr. Michael Heller, an associate of the practice. I graduated NYU Dental School in 2018 and then completed a general practice residency in 2019 at St. Barnabas Hospital in the Bronx and stayed a second year as chief resident where I studied advanced endodontics, implantology, and advanced restorative dentistry. One of my absolute favorite sayings that I learned when I was in residency from one of my mentors that he used to say all the time was, every patient, every time. And he meant it in many different ways. He meant it in regards to, certain protocols that had to be followed and, certain things that had to be, documented on every patient. But I think the overarching theme that he was trying to communicate was treat every patient with absolute dignity, give every patient your absolute best, and always, always, always make sure that every patient feels comfortable and safe and happy to come to the dental office. We want to welcome you back. We are reopened fully for all your dental needs, and we hope to see you soon.
Hi, I'm Dr. Simon Rosenberg, and I made a commitment years ago to present high-tech dentistry with a gentle touch. A year ago, I made a decision to renovate the office to make a commitment to my patients long term. We have totally renovated lighting, ceilings, walls, floors. We've revamped everything in terms of brand new chairs with the latest in technology immediately available. We continue to use BioLase lasers to provide shot-free restorations and periodontal therapy that sterilizes the pockets. In light of the current situation, we took 13 weeks off. We brought the staff in a couple of times during that period and looked at all of the things that we were concerned about for ourselves and for our patients, and have put in place a whole series of measures that provide for your safety, my safety, and the safety of our staff. You'll be greeted at the door by one of the staff members. We'll take your temperature. We'll ask you some medical questions, and we'll bring you over to the Purell station where you can Purell your hands. If you don't have a mask, we will provide one for you. We'll bring you to the operatory, review everything that's planned for today, and you'll rinse out with an antiseptic chlorhexidine rinse for 45 seconds, and then we can begin. We're very conscious of the issue of aerosols, and so in the operatory we have a HEPA filter which is able to measure how many particles there are in the air, and it adjusts its speed. It will redo the entire atmosphere, the whole volume of air, anywhere from every 10 minutes to every 2 minutes, depending on the speed that it measures. In addition to that, we use Isolite, which is an adaptation to the high-speed suction, high-speed evacuation, and with that, it has a very flexible bite block and two little arms that extends, keeps your tongue back, wraps around, keeps the cheek away, and it provides both a fill-in light, but more importantly, high-speed evacuation of any aerosol that might be produced. In hygiene, we've added a Vanamin high-speed evacuator. It looks kind of like Snuffleupagus to me. It has HEPA filtration, and it brings a flexible hose right up to your mouth, so that if we're using the Cavitron in hygiene for cleaning, or we're using the spray bicarbonate to lighten your teeth, we're able to provide it with minimal release of any aerosol. We used the 13 weeks that we were closed to take a number of online continuing education courses, get up to date with the technology that was being released and available to dentistry for 2020. and we're looking forward to welcoming you back to our office. We're fully staffed, we've rehired everybody, and we want this to be a place where you feel safe and secure to get your dentistry, whether it's just your regular checkups, cleaning and x-rays, or it's more extensive dentistry that we're capable of providing.